Hi, this is Colleen Parsons with part 2 of the musculoskeletal assessment. So we start with our health history questions, and they are typical health history questions. Do you have any pain or problems with your joints? Where, which joint, one or both knees, one or both elbows, shoulders? What does it feel like? And here where it says is you're describing the pain, don't describe it for them first. You wait for them to describe it, and if they're having difficulty giving you a specific feeling, then you can say, well, is it stiff or sharp or dull or shooting? But you wait for that. And severity, how strong is the pain on a scale of 1 to 10? When did it start? What makes it worse? What makes it better? Other health history questions that go along with joints. Do you have any swelling or heat or redness? Any limitation of movement? Those are two very important questions. Which activities give you problems? Did anything happen to cause this? And then you ask the same sorts of questions with muscles. You're asking specifically for pain and cramping of the muscles, and if so, which ones? Are your muscles achy? So if you do have achy muscles, is that associated with some sort of fever? And bones, do you have any bone pain? How about your range of motion? Do you have full range of motion, or do you have limited motion in some way? What part of your back hurts? What specifically? And here they're talking about shooting down the leg. That would be sciatica pain. And very often for patients who have back pain, it's difficult for them to determine whether it's neurological or bone pain or muscle pain, and that's for you to help them figure out. To joint muscle pain, so here's where we're talking about our ADLs like we were before. Bathing, toileting. How difficult is it for somebody to get off the toilet? Can they move their bowels? Or now when you can't move your bowels regularly and there's a slow motility there, that's a muscle. Your GI tract is a muscle. So that will give you some indication of what's going on. Can the patient wipe themselves, or are they limited in that sort of movement? That's a very important question, especially if you're noticing some limitation with the ADLs. How about dressing? Can they button? Can they zipper? Those sorts of tying their shoes. Is it time to get Velcro shoes if they're having difficulty tying? If they can't zipper, maybe they need to go to elastic waisted pants. Grooming. Shaving. Men end up having a very difficult time shaving, in part because their face gets more wrinkled. It gets harder to get at. Those of you who have shaved one of your male patients know that to be true. And their beard whiskers get much tougher, and they can be quite difficult to get off. Brushing teeth, fixing your hair. If you can't get your hands all the way up to the top of your head, you might not be able to brush your hair. How about applying makeup? Eating. Do they have a tendency to pour food down? Well, I do all the time. But I have a tendency to pour food down the front of them because of poor muscle movement. Mobility. Can they get out of the house? Can they get to the store? How long can they be up? Now, the mobility may be physical it may be muscular as far as, or skeletal as far as being able to move, but it could also be cardiac or respiratory. So you'll have to sort all of those pieces out. Self-care behaviors. Are they risk takers? Do they do things that would cause them pain? what comes immediately to mind is riding skateboards. What immediately comes to mind is riding a skateboard. If a person has a chronic disability or crippling illness, how does that affect how they interact with their friends or family? How do they view themselves? So we have now a mental health component to that. If it's in children, has there been any trauma? Was there any trauma for a newborn during labor? Babies are not infrequently born with dislocated hips, broken clavicles, rarely a broken leg, but it's usually a clavicle or a dislocated or broken hip. Adolescents, have they been involved in sports? Do they have frequent broken bones or injuries to their body? Students from time to time will tell me about difficulties they've had with sports-related injuries or just life-related injuries and diagnoses that came as a result of those injuries, multiple injuries. Aging adults, you're going to pay special attention to their functional assessment. Can they take care of themselves? So a patient is, an elderly patient is driving still. Well, that's all fine and good, but can they actually use a full range of motion with their neck so that they can look both ways and not cause an accident? So we've got the eyes involved, we've got the neck movement involved, and we have the, when we get to neuro, we have a response involved. And that's the end of part 2.